The United Nations Children's Fund says kids are particularly affected by the Democratic Republic of Congo's Ebola outbreak. Meanwhile, the experimental Ebola treatment appears to be successful, according to Congo's health authorities. 13-year-old Dieudonné has lost 8 members of his immediate family to Ebola. The United Nations Children's Fund, UNICEF, says children represent an unusually high proportion of people affected by the ongoing outbreak in the eastern DRC. Some children have contracted the disease, but others, like Dieudonné, have lost family members.
They all died of Ebola. It was my entire family. It was my mom initially, and then my sisters and aunt followed. And others in the hospital. I've lost 8 family members.
Health workers are going out on campaign drives to speak to the public, including children, about Ebola and how to protect themselves from the virus. Ebola treatment centers in Beni and Mangina are currently treating some children who were infected with the virus or are suspected cases. 2 children have already died from the disease. UNICEF has identified 53 orphan children who have lost their parents to Ebola.
I can't just kill myself. I must continue to live even in this situation.
The UN organization and its partners have trained 88 psychosocial workers to assist and comfort children in centers, as well as those who have been discharged. Meanwhile, health authorities in Congo say the new treatment MAB 114, administered for the first time ever on Ebola patients, is working.
When
we went to Mangina, there were 5 or 6 patients, and 2 in a severe state. I said we need to treat everyone with the MAB 114. We can't say we only administer to the less serious cases. We treated all levels of the illness, so some of them were very serious, and in particular, a child who had bloody stools, and after this treatment, he is now recovering slowly.
The DRC Health Ministry has approved 4 more experimental treatments to address the outbreak. Overall, at least 59 people have died and about 75 people are infected. The Ebola virus causes hemorrhagic fever and severe bouts of vomiting and diarrhea. It is spread through direct contact with body fluids from an infected person.